Assalamualaikum and a very good day. Welcome back everyone to chapter 2. In this chapter, what we will learn is how to write a clinical entry in patient's medical records, which is the hallmark of the duties of a houseman. Basically, when you work as a houseman, you are supposed to assist in documentation. There is a lot of documentation, and the specialists, the medical officers, the nurses, the pharmacists are relying on you to document properly. So this chapter will help you to achieve that, right? So basically, this entire MOOC, what we want to achieve is for you to understand the principles of good documentation, identify common errors, and of course at the end we want you to be able to document everything by yourself. We want you to be empowered. Alright, for this topic specifically, this chapter specifically, we want you to be able to identify common mistakes in documentation in patients' medical records, and we want you to be able to practice writing clinical entries accurately. Alright, so this is the normal anatomy of a clinical records. It's just a piece of blank paper with lines, right? So if you are using a electronic medical record system, you are very fortunate. But this we will be teaching you the manual method so that you can actually survive in case you are going to areas or working in hospitals where electronic medical records is not widely or completely not available in your hospital. Okay, so if you can see on the top left, right, is the place where we actually put the date followed by the time. So for every clinical documentation, this must be stated, and then at the top you should put admission clerking, or for another example is AM or PM review, or if you are seeing this patient with somebody with your MO or specialist, or this case is not seen by somebody but has been discussed and you want to document that discussion, you can put discuss with. For example, you discuss with your pediatrician colleague, you want them to have an opinion on this management. All right, or you want to put retrospective documentation, you want to document something in the past that you have not yet have the chance to document at the time. All right, and then you have your clinical entry. All right, and you can put your investigation, usually written on the left, and your plans of treatment on the right. Okay, so this is the template for clinical documentation. You don't have to follow it, but the most important is the date, time, the plan, whatever the entry is, and also your signature and chalk. Right, so just to give you a brief understanding, so this is a case scenario of Mr. Ahmad bin Saleh, who has developed acute heart failure as a complication. He initially admitted as infected diabetic foot ulcer, and then amputation was done, debridement was done, but then in the ward he got heart failure, and your duty is to, as a houseman, is to inform the family members regarding the patient's condition, and then you want to discuss with the family whether this patient should have cardiopulmonary resuscitation. So you have discussed with the family, and the family actually do not want CPR, and they want to sign a DNR form. Okay, your task is to document this communication in the case note. So this is a typical example of cases that you may actually see in your clinical duties soon. All right, so this is example of an entry made by our student. Okay, so this is his first attempt to write a clinical entry ever. Okay, so what he write is that this patient, Mr. Ahmad bin Saleh, has developed acute heart failure and his condition is not stable. Patient and family has been informed the condition, and about the resuscitative measure, the family wants to sign a do not resuscitate order. So this is a good try, but there is a lot of improvement to be made. First, where is your date and time? So if there is no date and time, your documentation is not complete. All right, the information needs more to be complete. Okay, so your signature must be followed by your name, must be followed by your MMC number, your position, whether you're a houseman or a medical officer, and your hospital name. All right, so the date at the bottom here is not accurate lah. Okay, but at least he have some date, so but he just needs some timestamp, right? Okay, this is another example by another student. This is a better attempt because you have more information. However, as you can see, for every entry there should be a signature. Okay, this was not put in place lah. Okay, the clinical entry actually can be improved. For example, it is stated that the patient was given medical therapy for ACS. Because this is a clinical records, you have to document what was given to the patient. This is very vague, yeah, which is cannot be used. Alright, so to improve, for every entry that you made, you have to put signature and job. Alright, okay, so this is a good example. This is written by me. Apologies for my handwriting. Okay, for example, this is a better example. Discussion with family members, yeah, wife and son. If you want to be more specific, you just should state what is their names, yeah. Family members, wife and son, were updated and patient current condition. The patient was initially admitted for DFU, treated with antibiotics and underwent wound debridement. Post-operatively, patient was well and planned to be discharged today with oral antibiotics and daily dressing at Klinik Kesihatan. However, while awaiting discharge, he had shortness of breath and chest pain. You see, I'm using a short form. This is permissible in clinical entry. And he was subsequently diagnosed to have heart attack. At the moment, patient suffering from acute heart failure. Family members informed that this condition is bad and death is in the line. Yeah, this documentation is just to cover us that we have informed family members. We have already break the bad news that his condition is not good. Okay, so what is the gist of the other documentation is that we have discussed this with the family members. They are not keen for active resuscitation and they actually wanted to sign a DNR form, my signature, my name, my MMC number, my jawatan and my hospital. Okay, this is example of a complete documentation. So I use the entire page of the paper to document this. Okay, because this is a significant documentation. Right, you also need to know common pitfalls of writing clinical entry. Number one, like we have seen in previous examples, the information provided the entry is not adequate. But don't worry, this comes with practice. When you go to the ward, see how the medical officers, the housemen, they document their clinical entries. Yeah, your handwriting is bad. This is a pitfall as well. Yeah, I'm also having trouble to read my own handwriting just now. Okay, another pitfall is to failure to write your date and sign. Okay, this is quite common in electronic system where you can actually copy and paste, and what happens is that you copy and paste something that is no longer relevant, yeah, or it also happens in a paper system. Yeah, so basically we read what happened yesterday, but actually a lot of things have changed, so you should use the updated version or write a new entry that is more reflective of the situation rather than completely relying on the system, on the past entry. Right, the other issue is which is my students are quite aware, is that the doctors fail to document the consent taking process. Yeah, so consent taking process is crucial for you to document every information that you provided to the patient. You must document. You inform the risk. Risk number 1, risk number 2, risk number 3 must be documented. Every questions that the patient asks you must be documented. The answers that you given to the patient must be documented. It doesn't have to be so in verbatim, but at least you document it. What is the answer that you have given, so that whenever you are being called to court, you can actually show to the court that you have addressed the questions by the patient and the patient agreed. You have given ample opportunity to the patient to ask questions. Okay, so if the patient accuse you that they do not understand, you can actually have a defense. Okay, if you are providing leaflet or pamphlet to patient as an educational material to make them more aware of the operation. You can actually photostat these pamphlets or leaflets and put it in your medical record as an official document to protect you. Okay, so we are at the end of our lecture for this topic. So basically what we want from this lecture is basically to identify the common mistakes in documentation, and we want to practice writing clinical entries accurately. Okay, we have put some reading materials, and don't forget for this chapter, please complete the quiz for your attendance can be recorded. Okay, with that I thank you. I see you in the next chapter.